tests that your doctor may order if he or she thinks that your child's kidneys are not working as well as they should be. The first test that's almost always done when we want to look at how somebody's kidneys are working is a test called serum creatinine. And it's a blood test. And creatinine is a molecule or a compound that's made in your body every day. It actually comes from the muscles. And because that amount of creatinine which is made every day is practically speaking unchanged, so the amount you make today will be the same as tomorrow, and because the creatinine itself is almost totally cleared only by your kidneys, we can use those two facts to help estimate how well your child's kidneys are working based on the change in that number from day to day. The second number that we often use and is ordered almost always at the exact same time as the creatinine is a number called your BUN, or your urea number. And urea is a compound that's also found inside your body, and we measure it in your blood. But this is almost always something that comes mainly from your diet and the amount of protein that you eat. Protein foods being, for the most part, meats or even milk and other products like that. And the value of the urea is a little bit different than creatinine. It's a better marker for how well hydrated you are, how much water you have in your body, and how well your body is responding to the need to hold on to water if you're sick and vomiting or diarrhea or what have you. Like sodium and potassium, chloride, and then we also use a measure of how well your kidneys are handling the acid and base in your blood, something called bicarbonate. And with these four tests, when they're ordered together, and an understanding of why your child has come to see the physician, we can often make judgments about how well or how poorly your kidneys are handling important decisions about those salts, as well as control of fluids inside your child's body. We're very interested in how that urine actually looks, and we have a number of different markers that we can look at, whether it's in the emergency department or an outpatient lab, to help judge how healthy your kidneys are by looking at the urine. For example, the presence of a large amount of protein in the urine usually means that there's been some damage to the kidneys, either within the kidney itself or occasionally lower down in the bladder. More commonly, what we see in children is we often see the presence of blood in the urine. And oftentimes that simply reflects high fevers. Occasionally it reflects the presence of a urinary tract infection where you get bleeding in the bladder. But from a kidney point of view, we can also often differentiate where the blood comes from by looking at it under a microscope. And in some situations, we can actually tell you that your kidneys themselves have been injured because of the type of blood that we see in the urine. The final thing that we usually will notice in the urine is the presence of white blood cells, and that often reflects the possibility that your child has a bladder infection or occasionally even a kidney infection. And that sign in particular will lead your physicians to sending the urine off for another test, a urine culture, in the hopes that if in fact this is a bacteria growing in the bladder or the kidneys, that we'll be able to grow that in the lab and then direct therapy towards fixing that for your child, usually utilizing antibiotics. We also occasionally want to have a better look at the physical aspects of your kidney. In other words, take a picture. And the most common way we do that is by using something called an ultrasound. That test is usually not done immediately when you go to see your physician. It's done through an appointment at a clinic. But the test itself is very quick and easy to do, and there's no pain involved, and does give us excellent pictures of what your kidneys look like, both how big they are and where they are inside your body. The final test that I wanted to mention today, which is not done very often but can be done if the physicians have any concerns about how well your kidneys are working, is a test called the GFR, or glomerular filtration rate. And that's a test that's really only done in specialized centers, specialized x-ray departments, such as you'd find at a children's hospital. And what we do with this particular test is we inject a very small amount of dye into your child's hand. It has a very, very low count of radiation, less than 1 or 2 chest x-rays. And when we inject that dye, and the lab then takes a number of blood samples after that, we're able to calculate how quickly your kidneys are able to clean your body of that particular material. And that gives us a better estimate than anything else that we have about how well your kidneys are actually working and cleaning your blood.